Hello, I'm Dr. Helen Rostill. I'm the Director of Innovation and Development at Surrey and Borders Partnership NHS Foundation Trust. The project centres around delivery of a telehealth solution for people with severe and enduring depression who are using our secondary mental health services. It's a way of delivering an evidence-based intervention via video conferencing on a weekly basis. So we're delivering behavioural activation, which is covered in the NICE guidelines for depression, and also being able to monitor a whole range of symptoms and behaviours in the week in between their video conference sessions. So that means that we're able to be alert to people's progress on a day-by-day basis, and we're able to pick up early signs of people becoming unwell quickly and to respond quickly, so through instant messaging or by phoning people. So it really fits with our trust philosophy around early intervention and prevention services. I wanted to start this project as a way of looking at innovative designs to deliver services to people using our secondary mental health services. Based on my understanding of the literature and previous projects that had happened in the States and Australia, for example, I was aware of an evidence base that was growing around the use of telehealth in mental health, being able to reach out to people in a much more flexible and convenient way, in a way that people found greater satisfaction with, that people could fit around their lifestyles, but also being able to deliver a quality evidence-based intervention that produced good outcomes for people. So this project's engaged and involved a whole range of different partners. So we've had a small design team which has included experts by experience, our clinical teams, our IT experts, and also Medvivo, who are the product designers. So working together to look at what the product the end product should look like. So that's been our first sort of point of engagement. I think what I'm really proud of is the co-design aspect with people who've used services. Also, we've engaged clearly with our clinical team. So one of the initial aspects of this project was about getting clinical engagement and getting people to consider delivering services in a different way to how they do traditionally. So we had to undertake quite a big piece of work to go out to the clinical teams, for people to see the technology, for people to really understand the model that we were trying to deliver. I'm delighted to say over time there's been a real engagement process from people being a little sceptical to begin with to really embracing this idea within our clinical teams. We've also done a lot of work with local stakeholders through launch events, and also obviously with our commissioners, the County Council, the CCGs, and spending time talking with them about progress that we're making and the overall aims through our steering board. Yes, there's a range of benefits, I think, to people using our services. Firstly, it's about access and convenience, so providing a service that people can receive at a time that suits them and their lifestyle, and receive in a number of different ways on their digital devices. It's also about providing an evidence-based intervention which we know is effective in terms of reducing symptoms of depression and anxiety, and helping people to make connections with their community, their families, friends, etc. We're also looking at well-being, so the aim is that this intervention will increase well-being for people and reduce demand on services such as GPs, A&E or inpatient services by providing an early intervention alert, which means that we can help people at an earlier stage as they become unwell, rather than waiting till a crisis arises. So we'd hope to see a real reduction in demand on those types of services. The other aspect is we want to deliver a service that people enjoy receiving, and we'll be looking at people's satisfaction with the service and also people enjoy delivering. So we're also looking at the satisfaction of our clinicians in delivering the service in this way. In terms of benefits to the NHS, I think clearly there's drivers around improving access to mental health, and I think this technology opens a new way for us to be able to do that. It demonstrates that you can deliver this type of solution in a secondary mental health care setting rather than just a primary mental health care setting, and actually manage people with quite complex needs. I think being able to intervene at an early stage before people reach the point of crisis is really important, as I've said, in reducing demands on services such as GPs, A&E and acute inpatient services. So in terms of cost savings, we expect to see there some benefits by delivering services using this type of technology. I think the other benefit for me is that this is a platform to extend services to a range of different types of groups. So we're working with commissioners and with MedVivo to think about what next, what's the next step.